Hey guys, this is Dr. Hub. Today we'll look at the FDA approved drugs. And this drug is as of the 2017. So under this, we are going to look at system wise and going to mention the drugs as well as a point on their mechanism or their indications. So first is cardiology. So in cardiology are the vascular diseases. So under this there is betrixaban. It is betrixaban. So this betrixaban, it is a factor 10A inhibitor, and it is used or the prophylaxis of the VTE. It is used as prophylaxis. It is used as prophylaxis of VTE. So what is VTE? VTE stands for the venous thromboembolism, and it is seen in adult patients who are hospitalized for the acute medical illness. So in adults hospitalized for the acute medical illness. Next we look at the hematology. So under hematology there is copanlisib. So copanlisib, it is a kinase inhibitor, and it is used to treat adults with replaced follicular lymphoma. So it is used to treat the adults, and this is with the relapsed follicular lymphoma, and they have received at least 2 prior systemic therapies, and they have received at least 2. So they received at least 2 prior systemic therapies. Next we move on to the drug inotuzumab and ozagamicin. So they are the CD22 directed antibodies, and so they are CD22 directed antibody drug conjugate. So it is nothing but the ADC, and it is to treat the adults. This is used to treat the adults and with replaced or refractive B cell precursors. This is with the relapsed or refractory B cell precursor ALL. That is what is this ALL? ALL here stands for the acute lymphoblastic leukemia. Next we look at the acalabrutinib. The acalabrutinib is nothing but a kinase inhibitor. It is used to treat the adults with the MCL. So it is a kinase inhibitor. Acalabrutinib is a kinase inhibitor, and it is used to treat the adults, and this is with the MCL. What is MCL? MCL stands for the mantle cell lymphoma. Mantle cell lymphoma. Next, they are in mantle cell lymphoma who have received at least one prior therapy. So they have received at least one prior therapy. Next, we look at the L-glutamine oral powder. So under the L-glutamine oral powder, there is an N amino acid. So there is N amino acid. So this is used to reduce the acute complications. So it reduces acute complications, and this is of the L-glutamine oral powder, it is a N amino acid to reduce the acute complications of the sickle cell disease. So acute complication of the sickle cell disease, and this is in case of the adults and the pediatric patients. So this is in terms of the adults as well as the sickle cell patients. Next, this in the pediatric groups. So in the adults and sickle cell patients as well as in pediatrics, that is less than 5 years of age. So less than 5 years of age, or it is greater or equal to 5 years of age. Next, we move on to the emicizumab. Emicizumab. So this is nothing but a bispecific factor 9A. So it's a bispecific factor 9A and the factor 10. So it is nothing but it is directed antibody, and it is used for the routine prophylaxis to prevent or reduce the frequency. So it is used for the routine prophylaxis. And this is to prevent. So it is routine prophylaxis to prevent or reduce the frequency or reduce the frequency, and this is of the bleeding episodes in adults and pediatric patients. So in the adults or the pediatric patients, so this is with the patients with the hemophilia A. So that is nothing but the congenital factor 8 deficiency. So it is nothing but the congenital factor 8 deficiency and with factor 8 inhibitors. Next, we move on to the enasidenib. So this is the isocitrate dehydrogenase 2 inhibitor. What is the isocitrate dehydrogenase 2 inhibitor, and it is used to treat the relapsed or refractory AML. So it is used to treat the relapsed or the refractory IAML. AML stands for the acute myeloid leukemia. And this is with the isocitrate dehydrogenase. This is with an isocitrate dehydrogenase, that is ICD. Isocitrate dehydrogenase, and this is nothing but the IDH2 and the mutation. This is detected by an FDA approved test. So this is by a FDA approved test. Next we look at the midostaurin. So midostaurin is nothing but a kinase inhibitor, and it is used in newly diagnosed the case of AML. It is used for the diagnosing of the case of AML, and this is a FLT3 mutation. It is FLT3 mutation, and this is positive detected. So it is mutation positive as detected by an FDA approved test, and in combination with the standard cytarabine. So it is in combination with the standard cytarabine and the daunorubicin. So, and by the daunorubicin induction and the cytarabine consolidation. So it is used in aggressive systemic mastocytosis. It is used in aggressive systemic mastocytosis. So it is nothing but the ASM. Then comes the systemic mastocytosis, and this is associated with the hematological neoplasms. This is associated with the hematological neoplasm, that is the SMAHN, or there is also the mast cell leukemia. There is a mast cell leukemia, that is nothing but the MCL. Next we look at the gastroenterology. So under gastroenterology there is the naldi-medin. So naldi-medin is nothing but an opioid antagonist. It is an opioid antagonist. So it's an opioid antagonist. It is indicated for the treatment of the opioid induced constipation. So it is an opioid induced constipation. And then comes the plecanatide. There is plecanatide. Plecanatide is nothing but a guanylate cyclase. It is a guanylate cyclase C agonist. So it's a guanylate cyclase C agonist, and it is used to treat the CIC. What is CIC? It is the chronic idiopathic constipation, and this is in case of the adult patients. Next we look at the telotristat. Ethyl. So this is a tryptophan hydroxylase inhibitor. It is a tryptophan hydroxylase inhibitor, and this is to treat the carcinoid syndrome diarrhea. So for the treatment of the carcinoid syndrome diarrhea. Next we move on to the topic of the endocrinology. So under endocrinology there is semaglutide. So what is specific about semaglutide? It is a GLP-1. So what is meant by GLP-1? GLP-1 is nothing but a glucagon-like peptide. It is a glucagon-like peptide, and this glucagon-like peptide 1 receptor agonist. So it is indicated to improve the glycemic control in adults. So it improves the glycemic control in adults, and this is with the type 2 diabetes mellitus. Next we look at the dapagliflozin, and the saxagliptin. Dapagliflozin and the saxagliptin. So they are nothing but the sodium glucose cotransfer 2. So in short it is known as the SGLT inhibitors, and a dipeptidyl peptidase 4 inhibitor. So dipeptidyl peptidase 4 inhibitor. So in short it is known as the DPP4. So it's a combination, and it is indicated as an adjunct to diet. So it is indicated as an adjunct. It is an adjunct to the diet as well as the exercise to improve the glycemic control. Also the exercise to improve the glycemic control. So the glycemic control is in case of the adults with the type 2 diabetes mellitus and who have inadequate control with the dapagliflozin. So who have inadequate control with the dapagliflozin, or who are already treated with the dapagliflozin and the saxagliptin. So who are treated with the dapagliflozin or the saxagliptin. Next we move on to the hepatology. Under hepatology it includes the hepatitis B. So the hepatitis B vaccine, we are looking at the recombinant and the adjuvant. So it is indicated for the prevention of the infection caused by all subtypes of the hepatitis B. So hepatitis B virus infections, it deals with that. So it is the subtypes, all the subtypes, and it is also approved for the use of adults 18 years or older. So greater than or equal to 18 years of age. Next we look at the glycapravir or the pibrentasvir. We look at the glycapravir or the pibrentasvir. So this is nothing but FDC. FDC is nothing but the fixed. FDC is nothing but the fixed dose combination of the glycapravir and it is nothing but a hepatitis C virus. So that is nothing but the HCV, that the NS3/4A protease inhibitors, and also the pibrent as well, and that is a HCV NS5A inhibitor. So it is a HCV NS5A inhibitor, and it is indicated for the treatment of patients. And this is with a chronic HCV genotype. So it includes the GT 1, 2, 3, 4, 5, 6 infection, and this is without the cirrhosis and with compensated cirrhosis. So this is without the cirrhosis. As well as with compensated cirrhosis and with compensated cirrhosis. So that is nothing but the child PUG A. Then we move on to the sofosbuvir, velpatasvir, and the voxilapravir. So this is FTC, that is a fixed drug combination, and it is of the sofosbuvir, and it is nothing but the hepatitis C virus. That is the HCV virus. It is a nucleotide and nucleotide analog, that is, it is NS5B. Polymerase inhibitors, PI stands for the polymerase inhibitor. The velpatasvir, and an HCV NS5A inhibitor, HCV NS5A inhibitors, and voxilapravir. It is a HCV NS3/4A protease inhibitor. It is indicated for the treatment of the adult patients. So it is indicated in treatment of the adult patients, and this is with the chronic HCV infection, and it is without cirrhosis. So this is without the cirrhosis and with compensated cirrhosis. So that is nothing but the child PUA, and who have 1, 2.2 and 14. Next we move on to the nephrology. In terms of nephrology, there is the etelcalcetide. So this is a calcium sensing receptor agonist. And it is used to treat the secondary hyperparathyroidism. Hyperparathyroidism, and this is in terms of the adult patients with the CKD. So it is in adults with the CKD and who undergo the dialysis. dialysis. Next we move on to the meropenem. So meropenem as well as the vaborbactam. So it is nothing but a combination of the meropenem, combination of the meropenem. This is a penem antibacterial. So it is nothing but the penem antibacterial as well as the vaborbactam. The vaborbactam is a beta-lactamase inhibitor. And this is used to treat the adults with a complicated urinary tract infection. So adults with complicated urinary tract infections, that is nothing but the UTI. So what does it include? This includes the pyelonephritis. So it includes pyelonephritis and is caused by the designated susceptible bacteria. Caused by the designated susceptible bacteria. Then we move on to neurology. In neurology, what are the drugs? In neurology, we look at the deutetrabenazine. Deutetrabenazine. So in deutetrabenazine, there is a VMAT2. So what is meant by VMAT2? VMAT2 stands for the vesicular monoamine. Vesicular monoamine transporter. So vesicular monoamine transporter 2. So this inhibitor is used for the treatment of chorea. So it is used to treat the chorea and it is associated with the Huntington's disease. So it is associated with the Huntington's disease and also the tardive dyskinesia in adults and the tardive dyskinesia, and this is in terms of the adults. Then we move on to the valbenazine. So in valbenazine there is a VMAT2. So what is meant by VMAT2? VMAT2 is nothing but, we have already discussed, it is a vesicular monoamine transporter 2 inhibitor. So it is used to treat the adults with a tardive dyskinesia. So it is used to treat the adults with tardive dyskinesia. Next we move on to the edaravone. So what is the edaravone? So edaravone is nothing but a member of the substituted 2. So it is a member of the substituted 2 pyrazoline, and this is a pyrazoline 5 class. It is used to treat the patients with the ALS. So it is edaravone. This is important. It is used to treat the patients with ALS, that is amyotrophic lateral sclerosis. Then we move on to the safinamide. The safinamide is nothing but a monoamine oxidase, monoamine oxidase, that is MAO, type B inhibitor. So this type B inhibitor is indicated as an adjunctive treatment. So it is used for the adjunctive treatment to the levodopa carbidopa in patients with levodopa carbidopa. This is in patients with the Parkinson's disease. PD, let's write it as Parkinson's disease. So these are who are experiencing the off episodes. Next we move on to the rheumatology. So in rheumatology there is a sarilumab. So in case of sarilumab there is a interleukin 6. There is interleukin 6 receptor antagonist. So interleukin 6 receptor antagonist. So this interleukin 6 receptor antagonist is used to treat the adults rheumatoid arthritis. Next, there is also the ocrelizumab. So this is nothing but a CD20. It is a CD20 directed cytolytic antibody. It is a cytolytic antibody, and it is used to treat patients with the relapsing and primary progressive forms of multiple sclerosis. So it is used to treat the multiple sclerosis and who presents with the relapsing and primary progressive forms. That is in case of relapsing as well as the primary progressive forms. Next, we move on to the oncology. In terms of the oncology, there is abimaciclib. So in abimaciclib, it is a kinase inhibitor and it is used to treat certain advanced or metastatic breast cancers. So it's for advanced or metastatic breast cancers. Then there is neratinib maleate. So in neratinib maleate, it is nothing but a kinase inhibitor, and it is indicated for the extended adjuvant treatment. So extended adjuvant treatment, and this is of adult patients. This is going to be of adult patients and with early stage HER2. So this is with early stage HER2. It is overexpressed and amplified breast cancer. Then we move on to the ribociclib. So in ribociclib, it is a kinase inhibitor. We are writing it as Ki. It is used to treat the postmenopausal woman with hormone receptor positive. So it is with the postmenopausal women and they are ER positive. So HR positive, that is a hormone receptor. HR positive, that is hormonal receptor positive, and they are also the HER2 negative. Yeah, HER2 negative. Advanced, they are HER2 negative, advanced or the metastatic breast cancer. Then we move on to the durvalumab. The durvalumab is a programmed death ligand 1. So it is a programmed death ligand 1. So what do you mean by programmed death ligand 1? It is nothing but the PDL1. So it blocks the antibody to treat the patients with locally advanced or metastatic urothelial carcinoma. So it is used to treat the blocking the antibody to treat patients with the locally or advanced metastatic urothelial carcinoma. So the durvalumab, it is a programmed death ligand 1, PDL1, blocking the antibody to treat the patients with locally advanced or metastatic urothelial carcinoma. Then we move on to the brigatinib. So in terms of the brigatinib, it is a kinase inhibitor. It is used to treat. It is a kinase inhibitor and it is used to treat the patients with the ALK. So it is used to treat the patient with the ALK. ALK is nothing but the anaplastic lymphoma kinase. So it is a anaplastic lymphoma kinase and it is positive metastatic. It is positive metastatic non-small cell lung carcinoma. So it is a non-small cell lung carcinoma. So who have progressed on or are intolerant to the crizotinib. They are who have progressed on or are intolerant or they are intolerant to the crizotinib. Next we will look at the niraparib. So niraparib, it is a poly that is ADP ribose and polymerase, that's PARP inhibitors. It is indicated for the maintenance and treatment of the recurrent epithelial. So it is used for the treatment of the recurrent epithelial ovarian as well as the FT stands for the fallopian tube or primary peritoneal cancers or the primary peritoneal cancers and who are in complete or partial response to the platinum based chemotherapy. So they are in complete or partial. They are in complete or partial response and this to a platinum based chemotherapy. Platinum based chemotherapy. Next we look at the pulmonology. So in terms of pulmonology, there is a benralizumab. So in terms of benralizumab, it is a interleukin 5 receptor alpha. It is a interleukin 5 receptor alpha. It is receptor alpha directed cytolytic monoclonal antibody. Directed cytolytic monoclonal antibody, that is IgG1 and the kappa. So this is for an add-on maintenance treatment of patients with severe asthma. So it is used as an add-on. It is used as add-on, and this is to the patients with severe asthma. Severe asthma, and they are aged 12 or higher than that, and with an eosinophilic phenotype. Then eosinophil phenotype. Then we move on to the internal medicine. In internal medicine, there is letirmovir. There is letirmovir. So letirmovir is nothing but a CMV DNA. It is a CMV DNA terminase complex and terminase complex inhibitor. It is indicated for the prevention of the CMV infection. For the CMV means the cytomegalovirus infection, and following the allogenic hematopoietic stem cell transplant. Following the allogenic hematopoietic stem cell transplant. Next we look at the dermatology. So in terms of dermatology, there is avelumab. So avelumab is nothing but a programmed death ligand 1. Programmed death ligand 1. So it is nothing but the PDL1 blocking antibody to treat the metastatic Merkel cell carcinoma. It is a blocking antibody to treat the metastatic Merkel cell carcinoma. Then we move on to the delafloxacin. There is delafloxacin. So this is nothing but a fluoroquinolone antibacterial to treat the patients. The fluoroquinolone antibacterial, and is used to treat the patients with the acute bacterial skin infections. Acute bacterial skin infections. Then we move on to the dupilumab. So in the dupilumab, it is interleukin 4 receptor alpha antagonist. Is interleukin 4 receptor alpha antagonist, and it is used to treat the adults with a moderate to severe eczema. So it treats the adults with the moderate to the severe eczema, that is the atopic dermatitis. So it is an atopic dermatitis. Then we look at the brodalumab. So brodalumab is nothing but a human interleukin 17 receptor A antagonist. So it is a human interleukin 17 receptor A. So how do you write it? IL-17RA antagonist. It is used to treat the adults with moderate to severe plaque psoriasis. So the brodalumab is used to treat the moderate to severe psoriasis. Then we move on to the guselkumab. Guselkumab. So this guselkumab is an interleukin 23 blocker. So it is a interleukin 23 blocker, and it is used for the treatment of the adult patients with moderate to severe plaque psoriasis. Used to treat patients with the moderate to severe plaque psoriasis. Then we have the ozenoxacin. Ozenoxacin. So this ozenoxacin, it is a quinolone antimicrobial. It is a quinolone antimicrobial. So it is indicated to treat the impetigo. It is used for impetigo treatment. Then we look at the pediatrics. So under pediatrics, there is the Vestronidase alpha, So this is nothing but a recombinant human. It is a recombinant human lysosomal beta glucuronidase. And it is indicated to treat the patients, the pediatric as well as the adult patients with an inherited metabolic condition. So it is used to treat the pediatric as well as the adult patients with an inherited metabolic condition called, inherited metabolic condition. So what is this called? This is called as a mucopolysaccharidosis type 7. This is a mucopolysaccharidosis, and it is nothing but the type 7, that is a MPS 7. It is also known as a SLY syndrome. Then comes the benznidazole. So in benznidazole, it is nitroimidazole antimicrobial. So nitroimidazole antimicrobial, and it is indicated to treat the children with ages of 2 to 24 with the Chagas disease. So it is to treat the 2 to 24 age group with the Chagas disease. Next, we move on to the deflazacort. In deflazacort, it is a corticosteroid used to treat the patients with age 5 or older. It is a corticosteroid. It is used to treat patients with 5 years or older, and this is with the DMD. So what is DMD? DMD stands for the Duchenne muscular dystrophy. So D for D, that is a deflazacort, is used for the Duchenne muscular dystrophy. Next we look at the serliponase alpha. So serliponase alpha. So this is the hydrolytic lysosomal N-terminal tripeptidyl peptidase. So it is a hydrolytic lysosomal N-terminal tripeptidyl peptidase, and it is indicated to slow the loss of ambulation. So it slows the loss of ambulation, and this is in symptomatic pediatric patients. In the symptomatic pediatric patients, and this is 3 years of age or older, so it is greater than 3 years of age, and with late infantile neuronal ceroid lipofuscinosis type 2. So this is with, there can be with late infantile. So let's look at it. It is with the late infantile neuronal ceroid lipofuscinosis. This is type 2. So in short, it is known as the CLN2. It is also known as, that is aka, the tripeptidyl peptidase 1. Tripeptidyl peptidase 1 deficiency. Next we move on to the obs and gynae, that is obstetrics and gynecology. So here there is secnidazole. So the secnidazole is involved, it's a nitroimidazole antimicrobial. Nitroimidazole antimicrobial, and it is used for the treatment of bacterial vaginosis. The next drug we will see is the abaloparatide. So this abaloparatide is a human parathyroid hormone related peptide. It is a human parathyroid hormone related peptide. That is, in short, how do we write it? PTHRP 1 to 34. It is an analog for the treatment of the osteoporosis in postmenopausal women. It is abaloparatide. So it is in case of the osteoporosis in the postmenopausal woman, and this is basically at a high risk of fracture. It is at high risk of fracture, or those who have failed for other therapies. So also in case of the failed therapies. Next we look at the ophthalmology. So in terms of ophthalmology, it includes the latanoprostene. It is a latanoprostene, the latanoprostene bunod, ophthalmic solution. So it is a prostaglandin analog to treat. So this is a prostaglandin analog. So this is nothing but it is used to treat the intraocular pressure. It is used to treat the intraocular pressure, and this is with patients with the open angle glaucoma. With patients with open angle glaucoma or the ocular hypertension.